Welcome back to HSH TV. Today, I will be diving into some ways to keep your infusion supplies organized and out of sight when you're not using them. But before we get started, let's review some of the basics.
What is EMPAVELI? Pegcetacoplan. EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. What is the most important information I should know about EMPAVELI? EMPAVELI is a medicine that can affect your immune system and can lower the ability of your immune system to fight infections. EMPAVELI may increase your chance of getting serious and life-threatening meningococcal infections that may quickly become life-threatening and cause death if not recognized and treated early. EMPAVELI may also increase the risk of getting serious infections caused by certain bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. Serious infections may quickly become life-threatening and cause death if not recognized and treated early. You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines.
Like a lot of things in your home, you may not want your medication or supplies to be out in the open. That's where storage containers come into play. When it comes to my treatment supplies that are stored outside of the refrigerator, I love using drawers. I think they're easy to organize. I don't have to reach back into dimly lit cabinets or shelves to get what I need from them. Plus, keeping everything in a drawer is a great way to prevent others from finding what you may want to keep private. It's nice to make sure that wherever you're keeping your treatment supplies is in an area of the house that's away from others, whether that be a bathroom drawer or a drawer in your bedroom or your closet. You might have received my infusion studio from EMPAVELI, which was specifically designed to store the supplies you'll need for your treatment. It keeps everything together and organized. Plus, you can easily stow the case away in a large cabinet, closet, or under the bed. All reasons why I love it. What's great about this is that it isn't just any case. It was designed for you with your at-home infusion experience in mind. You can use it for storage, but you can also use it during your infusion as well. It comes with a few great features like a cup holder, a small tray you can use as an infusion space, and a few pockets to hold things like a tablet, a book, or your phone, whatever you want to have close by during your infusion. The case also has different compartments to hold all your infusion supplies, so you can keep everything in one organized place. My favorite thing about my infusion studio is that all of your materials are stored together, so you can keep yourself organized. And we all know that when it's organized, we establish a routine. If you don't have a My Infusion Studio, you can ask your Apellis Care educator about receiving one. Beyond storing your treatment supplies out of sight, there are some things you can do to incorporate storage into the design of your home if that's more your style. Just like in middle school when I would wrap my textbooks in paper bags, I like to wrap the binders and folders where I keep my medical records in simple craft paper or handmade paper. Once I do that, they become ornaments on the shelves in my space. No one would ever know that health documents are right next to the books and decor on my bookcase. Finding stylish containers in closed storage is another quick solve for hiding away something that you may not need to be seen, but it's important to have close by. As you know, safety is key when you're deciding on any storage solution. However you store your medication and supplies, make sure the space that you choose is out of reach for pets and kids, if you have any. Remember, when things feel organized, they feel clean. And when things feel clean, they feel healthier, which is exactly what you want as you embrace a new treatment routine.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. EMPAVELI can lower the ability of your immune system to fight infections. It may increase your chance of getting serious and life-threatening meningococcal infections. And serious infections caused by certain bacteria, such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These infections may quickly become life-threatening and cause death if not recognized and treated early. You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines. If your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. And you should also receive 2 weeks of antibiotics with your vaccinations. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI. Vaccines reduce the risk of serious infections, but do not prevent all serious infections. Call call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever with or without shivers or the chills, fever and a rash, shortness of breath, extreme pain or discomfort, headache with nausea or vomiting, high heart rate, headache and a fever, headache with a stiff neck or stiff back, confusion, muscle aches with flu-like symptoms, clammy skin, eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. It is important to show this card to any healthcare provider to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have not been vaccinated against Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B, unless your healthcare provider decides that urgent treatment with EMPAVELI is needed. Have a serious infection caused by the previously mentioned bacteria. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion. Stop your EMPAVELI infusion and tell your healthcare provider or get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, swelling of your face, tongue, or throat, feeling faint, or pass out. The most common side effects of EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash. These are not all of the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. Please see important safety information, including boxed warning regarding risk of serious infections, and the full prescribing information and medication guide at empaveli.com.
That's it for now, but don't forget to watch the other videos available through HSH TV. I'll see you next time.